So Representative Cantrell moves that House File 269 be laid over for possible inclusion in an omnibus in our division bill. Representative Cantrell, go ahead and introduce your bill.
Well, thank you, Madam Chair, members of the committee. Today I'm presenting House File 269, and it's a bill that will appropriate $1 million in fiscal year 2020 and $1 million in fiscal year 2021 for the Commissioner of Health to award grants to organizations that have experience in working to reduce the transmission and prevalence of HIV and AIDS in the state of Minnesota. The grants will be awarded on a request and application basis, and I don't want to be too redundant with the information that was provided by Director Erzman, but I want to say that prevention is absolutely key to our overall, I think, public health strategy. As we've seen, new cases of HIV in Minnesota remain fairly steady over the past decade at about 300 cases per year. And these cases are distributed throughout the state of Minnesota. The highest concentration geographically that we see is within the city of Minneapolis and the 7-county metro suburb area. But of course, there are cases across the state of Minnesota. We know that it affects all of our communities. And if individuals who do end up being diagnosed with HIV have access to treatment early, it can really be a huge difference in the quality of life and the longevity that they are able to pursue as a result of that maintenance treatment and as a result of being able to access really essential medications. And I do want to draw a distinction. AIDS is different from HIV. In the fact that AIDS is an advanced kind of progression of someone who has contracted HIV. It essentially is a point at which the body's immune system can no longer really protect against opportunistic infections and cancers, and that is a point in time when really an individual is in most severe danger. But if someone's HIV infection is identified early, if treatment is began early, then that individual can live nearly equivalent to the time or a nearly equivalent lifespan as somebody who does not have HIV. So we've really made incredible strides in kind of the newer medical treatments and technologies that we have available to address the transmission and prevent the transmission of HIV and to make sure that individuals who do have HIV or AIDS are able to live long and really fulfilling and happy and healthy lives. So I'm joined by a couple of testifiers today, and I want to thank Director Erzman for her presentation. I'm joined by Cree Gordon, who is the HIV Prevention Coordinator from the Youth and AIDS Project, and Matt Tuberin, Director of Public Policy at Justice Health. And they'll be able to kind of talk a little bit more about some of the work that their organizations are doing, but there's a lot of really incredible work going on in the state of Minnesota, working to address the epidemic of HIV and AIDS in our state. But we as a legislature really need to make an earnest investment if we are to truly achieve the goals outlined by Director Erzman in her presentation. So with that, Madam Chair, if it's all right with you, I'll turn it over to my testifiers.
Absolutely. Welcome to the committee. Just please give us your name for the record and go ahead with your testimony.
Sounds good. My name is Cree Gordon, and again, I am the HIV Prevention Coordinator at the Youth and AIDS Project. I have been at YAP for about 8 or 9 months now, but I've been doing HIV work for 14 years. Yeah, I know my baby face doesn't show that, but my director often says that youth and young adults who come to YAP don't come to YAP because they slept with the wrong person one night, that there are events that lead them to coming to YAP and accessing our services. Many of our youth who come are often not only dealing with the idea that they might have HIV or gotten HIV or are living with HIV, but they're dealing with a whole slew of other issues such as like poverty and homelessness. Some of our youth are injection drug users. They're dealing with a lot of trauma, right? And I don't have to look far for an example of that. So the way I got into HIV work was 14 years ago. As a 19-year-old, I was a homeless youth and sex worker. And at the time, we have great testing technologies now, right? So youth can, or people can know their status in under a minute with our INSTI technology. But at the time, I had to wait 2 weeks for my results. And as a way to get the homeless youth to go back for their results, they would give us a $10 incentive. And my birthday was coming up, so I wanted a Happy Meal and a Reese's, right? And so many people don't think like a Happy Meal can change your life, but one changed mine. And I didn't know much about HIV or prevention. And I see that in all of the young people that I work with on a regular basis. And so having an increase, like the increase that is being asked would be very beneficial because it would allow us to be a little more innovative in how we're reaching youth and young adults. And I'm sitting here because a large portion, so last year in 2017, we had 284 new infections. 109 of those happened in folks under the age of 30. So it's still very prevalent, like in youth and young adults. A lot of the youth I work with or my new infections or the clients that we serve are youth of color, as you were talking about earlier. And so while we've made strides, we're still seeing new infections in young folks. So I hope you consider the bill being presented in front of you.
All right, thank you very much. And I know we have members with questions, but I'm going to let the testifiers get through, and then we'll open it up for questions and hope you'll stay and we can have a discussion.
Yes.
Thank you. Please introduce yourself.
Madam Chair and members of the committee, my name is Matt Buren, Public Policy Director at Justice Health, a newly formed organization that was a merger between the Minnesota AIDS Project and the Rainbow Health Initiative. So we serve roughly 3,000 low-income folks living with HIV, several thousand more folks at high risk, and also work on education and advocacy to achieve health equity for LGBTQ communities. It's an honor to be here before you today to testify in support of Representative Cantrell's House File 269. As Benjamin Franklin said, an ounce of prevention is worth a pound of care, and that is the real purpose of this bill. Given the dramatic progress in HIV/AIDS prevention and care, Minnesota has the opportunity to achieve an end to AIDS. While advances in antiretroviral treatment have dramatically improved the quality of life and length of life for people living with HIV, similar gains have not yet been achieved for HIV prevention. However, with proven prevention strategies for HIV-negative people at high risk for infection and in targeted interventions with HIV-positive individuals who are out of care, we now have the necessary tools to stop and ultimately reverse the epidemic. Inadequate state funding and recent reductions in federal funding for HIV prevention threaten the significant gains Minnesota has made in fighting this epidemic. Minnesota state funding for HIV prevention has remained flat since 1998. And I'll just repeat that one more time. Minnesota's funding for HIV prevention has been flat since 1998, while at the same time, our neighboring states like Wisconsin and Colorado have, in the last few years, increased their investments in HIV prevention. And as a result, their outcomes are surpassing our own. And where Minnesota once was a leader, we are now falling behind. In addition to inadequate state funding, due to changes at the CDC, Minnesota has lost over 40% of our federal prevention funding over roughly the last 7 years. Increased prevention resources for targeted high-impact interventions can be used to quickly test, diagnose, and link to medical care. The estimated 1,000 people in Minnesota who currently are unaware of their status. And in addition, funding is needed for increased interventions with the 40% of Minnesotans who are living with HIV and are not in treatment, to find and link them into care and medications. Increasing activities in these two areas will lead to a significant reduction in new infections across the board. So we have the know-how, we have the tools and ability to close these gaps, but what we lack are the resources. By investing in HIV prevention, we can save Minnesota's taxpayers money, we can save lives, decrease new infections, and we can reduce health disparities that are unacceptable and unjust. With increased prevention, we can continue the vital progress to eliminate HIV in Minnesota, and together we can once and for all end AIDS. So thank you again, Madam Chair and members, for your support for House File 269.
Very good. Thank you for your testimony. We have a question from Representative Munson.
Thank you, Madam Chair. And thank you for bringing this forward. This is a really great cause. I had a couple of concerns about the bill. I know it's a pretty small text, but the way I read this bill, that you're asking for $2 million in funds for the next 2 years total. How much of the $2 million will the Commissioner of Health charge for administering this program? I see in other bills, like another one we're hearing today, where the Commissioner of Health charges 15% of those funds. So if they were to use that same formula, that would be $300,000 that the Commissioner of Health would charge. And they're not actually doing the do here. They're just cutting the checks to nonprofits that they choose. Do you know what the percentage is that they'd be charging?
Representative Cantrell, if you want to answer that, otherwise we can call back Ms. Arizman and see if she can answer it for us, but please go ahead.
Thank you, Madam Chair. Representative Munson. I think I'll defer to Director Arizman. She might be able to answer that question thoroughly.
All right. Ms. Arizman's coming back. Welcome back. Please.
Thank you, Madam Chair and Representative Munson. Just two comments on that. First of all, for resources that we received that were referred to in 1998, the agency takes no money to administer those. Our feeling is that there would be some costs to administer these grants because we do go through a very rigorous RFP process, but we have not fiscal noted this. And so I can't give you a number, but I can assure you that your projection of 15% would be higher than what I would guess just based on staffing needs. So historically, we have not charged in the past, but we recognize that there are some costs, and so we'll have to fiscal note it, but 15% is very high.
Okay. And,
Representative Munson.
Thank you, Madam Chair. The next question, well, last week we heard a presentation about nonprofit companies being subsidies of for-profit companies and the inverse of that. And I'm just curious, would you be willing to take an amendment to this bill that would require that the nonprofit entities receiving these funds would not be subsidiaries of for-profit entities or being able to build their own company for services, so that we understand that the money is being used for for its intended purpose. And also, I notice in this that it's talking about using the money targeting communities at high risk of HIV infection, but there's nothing in this bill that prevents this money from being dispersed to a non-Minnesota-based nonprofit or going to a national nonprofit where the funds wouldn't even be coming back to this state, which is a concern of mine. Because, I mean, the largest at-risk communities, maybe you're in Africa or outside of the country even, and there's nothing in this bill that designates the funds that are being granted to a nonprofit to be used for communities in Minnesota, which is a concern of mine. And we have the ability to put some curbs in place on legislation as we create these larger programs. And we want to make sure that we're targeting those services here in Minnesota. I know that on the other side of the aisle especially, there's a lot of concern about million-dollar CEOs of nonprofits. Is there any caps on what some of these employees of these nonprofits can be paid that run these programs? Thank you.
Well, thank you, Representative Munson. That's a really good question, and it's one that I've never heard in connection with any of this, but I think it's a very valid question. I just wonder if maybe staff can help us with that, because I wonder if there's, when you get a bill like this, it's just one little section, but it goes into a statute where there's some context in there, and I wonder if Ms. Clarkvist can help us, if there are any guardrails around any of that, or if this has ever come up as an issue. Ms. Clarkvist?
Madam Chair and Representative Munson, so actually this is not placed in a statute. This is uncoded language. It's just appropriation language. So there's nothing there's nothing that this is going to be placed into. There might be administrative requirements at health that would govern nonprofits that are eligible for these grants and Minnesota-based populations.
Mm-hmm. And so, Ms. Arizman, do you know, are there guardrails around this, as Representative Munson is asking about, that require that these kinds of funds stay in Minnesota, that they how does, I know the department administers these and takes RFPs and so on. Does the department require that the RFPs be for populations in Minnesota? Are there any requirements around what kinds of organizations can be eligible for these funds?
Madam Chair, in the past, and as we've administered grants to organizations, they have all been Minnesota-based organizations that serve Minnesotans. And we're quite specific in looking at what the epidemiology of HIV is, what populations are at greatest risk, and then making sure that the resources are allocated accordingly. So in other words, if 50% of the cases occurred in a certain community, then the resources would be allocated like that. I certainly can say that we don't have a problem with having those guardrails put in place, because we certainly have never funded, an international outside entity or someone that's serving populations other than Minnesota populations. So.
Okay. Yeah, Representative Loeffler.
Well, thank you, Madam Chair. I haven't looked at this recently, but I vaguely remember back in my legislative career that the Department of Administration has a grants management office that, and I think it's guided by some statutes that directs state agencies and how to run these RFP programs and solicit responses. And they train the people in the various state agencies. And for the Representative Munson and others who are interested in it, you might want to explore with them that process. But I know there is some overall guidance.
Yeah, thank you, Representative Loeffler. And Ms. Clark, this maybe, I'm sure you're probably taking notes on this anyway, but maybe you can, when you get a chance, give us a little more of the landscape around this, because I think it is a very good question and one that we want to make sure always that our money is going where we hope it's going. But Ms. Arisman, I wonder then, I wanted to ask you, I'm glad you came back to the table. Could you just give us a little thumbnail of where the funds are coming from right now that are going to this HIV work? And it was said that it hasn't been increased since 1998. I mean, is there an ongoing appropriation for this? Is it just part of the base funding of the Department of Health, or are there federal funds? If you know, I don't know. I know you didn't come prepared to give us that information today, but I would kind of like to know what the background is for the work that we're already doing.
Madam Chair, yes, there was an appropriation specifically for HIV prevention, and as was discussed, that has not changed since 1998. We also do add some federal funds to that so that we can expand the reach, but the majority of the funding is state funds that were appropriated in 1998. I mean, that originally were appropriated in 1998 and continue to be appropriated in each biennium.
Okay, thank you. Other questions, members? Oh, I'm sorry, Representative Grunhagen has a question.
Thank you, Madam Chair. Yeah, this is a question for Ms. Ernstman. Is that the correct pronunciation? Anyway, when we give out these RFPs, do we ask for, to these nonprofits, do we ask for a report back as to what the money was spent on and what was actually accomplished?
Ms. Arisman.
Madam Chair and Representative Grunhagen, yes. We have grants managers that meet with each of the grantees, and they have objectives, and we're checking in on their expenses and things like that. So if they're not meeting the objectives that we've set out for them, if there are issues, we can rescind the grant. And you may want to hear from a grantee to tell you what it's like to receive funds, if you'd like to know a little bit more.
Representative Grunhagen.
Oh, thank you, Madam Chair. Yeah, I mean, does the money come in a lump sum, or does it come over a period of time, or generally, or does it depend on the RFP?
Ms. Arisman.
Madam Chair and Representative Grunhagen, the grantee will invoice us, so no, it's not a lump sum. What we do is we set up a grant with them, or a contract that says that, we are setting aside X amount of dollars, $50,000 or whatever, for your program. And then we work with them, and each month they are reporting in what they're accomplishing and then submitting invoices. And so there's definitely a check and balance. There's no sort of, here's your money, have a good time with it.
Uh-huh. And Mr. Gordon, would you want to just comment? I know if you would pull the mic back and just let us know what is it like for your organization as a grantee.
Sure, Madam Chair. Yeah, so it was funny when Representative, when you were asking the question, I was like nodding my head really hard, I realized, because I'm one of the people who writes the report, and depending on what the grant is and who I have it from, whether it's like MDH or DHS, we actually write pretty frequently. And so like, I know for me in my testing grant, I do 2 reports a year, every 6 months. And then the grant I get for PrEP, pre-exposure prophylaxis, I have to do 4 a year. And so we're checking in pretty frequently. We have calls. I oftentimes like talk to the folks over at DHS and MDH because I'm also part of the Minnesota HIV Planning Council. So yeah, it's an ongoing thing. I think, and if I can add, I think what some of this money will do is help us with the program. Like, it sounds like a lot, but once you start getting into the cost of some of the things that we have to deal with HIV, that money goes very quickly. So like, for example, I can help like link someone to PrEP, and I can even find them funds to pay for the actual prescription. But where I don't have funds or where I don't have support is them seeing the doctor every 3 months, because that's required to be on PrEP, and I don't have funds to help them pay for their lab costs if like they haven't met their deductible for their insurance. And so like, and those things can be very like expensive. So while that sounds like a lot, as we have all these interventions, but the cost of these interventions are very expensive. So, and most of us, because there was also the question about how do we like regulate to make sure like we aren't like frivolously like spending this, or like folks who are in leadership roles like myself aren't frivolously spending it. I didn't get into this to make money. I got into this so folks wouldn't have to experience what I had to experience, right? And so sometimes I'm living check to check myself, right? And so we don't do this like for a living. We really are doing this to like support the folks in our communities.
Thank you very much, Mr. Gordon. And, okay, so are there any other questions from members? Okay, oh, I guess I do have one more question, Ms. Erisman. We're talking about these drugs that a person has to take for the rest of their life, essentially, and I just wonder if you could give us a sense, since we're talking about prevention and lifetime treatment for somebody who gets infected, what is the cost of the drugs that, can you just give us a general idea of, I'm just thinking about, you know, the cost benefit of preventing someone from ever getting infected versus having to treat them for their entire life.
Madam
Ms.
Chair,
Erisman.
actually, as you were discussing the program, I was thinking that there are some estimates that lifetime costs for someone who's infected with HIV are about $300,000. So, you know, $1 million program is just slightly more than preventing 3 cases of HIV. But I'll let Mr. Gordon also comment.
Yeah, and that's a that 300,000 is a very conservative estimate, right? So, if I didn't have insurance and help from our state's AIDS drug assistance program, my medicine alone would cost $3,000. So that's roughly $36,000 a year. So that 300,000 wouldn't even cover the cost of 10 years of my life for just the medicine. That doesn't include like all the other costs that comes with living with HIV. And the thing is, when the biomedical intervention PrEP came around, it wasn't meant to like be taken for like the long haul or like the entirety of someone's life. It's to give them a tool for a short stints in their life if they just feel like they need the extra protection. Truvada costs roughly $1,500 a month if they can't cover the cost via insurance or other methods of like copays. And so we do see that like there really is a cost benefit of helping folks prevent HIV because it's expensive to treat. The drugs itself is probably the most expensive thing, but there are other costs that come with living with HIV as well.
All right, well, thank you very much, the testifiers. And final question, Representative Munson?
Yeah, my question, Madam Chair, is if I'm able to make a friendly amendment to this bill to add Minnesota-based in front of the word nonprofit and to add Minnesota in front of the word communities to this bill so that we ensure that these funds would stay with these great nonprofits that are testifying today, not these specific ones, but
Yeah.
ones like these, to prevent future potential of this money going out of the state or out of the country.
So Representative Munson, are you moving an oral amendment?
Yes.
Okay,
and-
so Representative Munson is moving an oral amendment, and would you please restate the amendment so that we can get that all down?
That would be to use the words Minnesota-based in front of the words.
Okay,
in
what
front of the-
line are you on?
Line 1.6, Minnesota-based in front of the word nonprofit. And to add the word Minnesota in front of, on line 1.7, in front of the word communities.
Okay, so Representative Cantrell, did you understand the amendment?
Yes, Madam Chair, I did, and I'm in favor of it.
All right, so Representative Cantrell, would you want to just incorporate that into your bill?
Yes,
Madam Chair, can we ask questions on the oral amendment? or
Certainly
no?
you can, Representative Olson.
Okay, thank you, Madam Chair. I guess I had a question. I hear that money doesn't go out, but does this change? I mean, there are nonprofits that operate across the United States that have local, affiliates that do this work, or I just don't want to have, right? I feel like this was a little quick, and maybe you had discussion offline. I don't know if you had discussion offline with Representative Munson about this, but I don't want to have unintended consequences with language that, I just am cautious that there are Minnesota communities too. I mean, if people receive health care, I just would want to not have unintended consequences and want to make sure that Representative Munson had talked with Representative Cantrell before this.
Other questions, members, comments? Representative Schultz?
I don't know if thank you, Madam Chair. I don't know if I like the word based, because you could have something headquartered in Minnesota and chapters or facilities outside of Minnesota, so I don't know if that addresses the concerns from Representative Munson completely. So could just say Minnesota nonprofit organizations in that line 1.6.
Okay, well, Representative Cantrell, do you have any other? So it sounds like we probably need to vote on the amendment. Unless, Representative Munson, do you want to stick with what you got here, or do you want to alter your motion?
Madam Chair, I would accept the amendment to the amendment.
So you're moving an oral amendment, and what does the oral amendment say at this point?
Adding the word Minnesota
Nonprofit.
in front of the word nonprofit, and adding the word Minnesota in front of the word communities on line 1.7.
Okay, so does everybody have that? So Representative Munson is moving to, on line 1.6, to add the word Minnesota before the word nonprofit, and on line 1.7, to add the word Minnesota before the word communities. Is there a discussion to that amendment? Representative Halverson.
Thank you, Madam Chair, and could we hear from the department to make sure that there's not going to be unintended consequences, or if there's any concern?
Absolutely. Ms. Erisman, do you want to comment?
Madam Chair and Representative Halverson, I don't anticipate that there would be a problem. I was commenting to my colleague here, sort of tongue-in-cheek, that we need to come back to you and report what progress has been made in Minnesota, and that's a real incentive to keep the resources here, because if we gave it to someone else, we wouldn't be able to tell you that we had made improvement in Minnesota. So I don't have a problem with these proposed changes.
Okay, so it's a little bit belt and suspenders, I'm hearing. But, and members, this bill is going to be laid over for possible inclusion in the division bill. So today is not the last day that we can work on this. But, but there is a motion before us to add this language. And is there any other? Representative Schultz?
Thank you, Madam Chair. Just a proper grammar, we might want to say grants to nonprofit organizations in Minnesota targeting communities in Minnesota rather than Minnesota communities or Minnesota nonprofits.
Representative Munson.
I'm sorry, Madam Chair. And was it Elizabeth?
Ms. Clark-Fist.
Ms. Clark-Fist brought to my attention that it actually should say on line 1.8 for Minnesota individuals living with HIV/AIDS. It's the
Okay, so Representative Munson, why don't you restate your motion?
Thank you, Madam Chair. The motion is to add the word Minnesota,
Have nonprofit organizations in Minnesota.
and it would say on line 1.7, targeting communities at risk for HIV infection for Minnesota. So adding the word Minnesota in front of individuals on line 1.8 living with HIV/AIDS.
Or the individuals living in Minnesota with.
Wait, okay.
Okay, for individuals, I would accept that. For individuals living in Minnesota with HIV/AIDS. Your English professor?
I think so. Just you forget this Minnesota.
Okay.
All
right, let
Madam Chair,
me-
Elizabeth, Ms. Clark-Fisk
Ms.
could.
Clark-Fisk,
state
can
the
you
amendment.
give us why don't you read back the oral amendment as you understand it?
Madam Chair, I guess I would suggest on 1.6, say, nonprofit organizations in Minnesota. So add in Minnesota after organizations. On 1.7, I would add in Minnesota after communities. And on 1.8, I would add in Minnesota after individuals.
Okay, so does everybody have that? And Representative Munson, is that your motion?
Yes, it is, Madam Chair.
Okay, does anyone need that restated? Okay, and is, Ms. Arisman, is that still something that sounds agreeable to the department?
Madam Chair, yes.
Okay, and Representative Cantrell, do you want to incorporate that language into your bill?
Yes, Madam Chair.
Okay, so Representative Cantrell incorporates, or we still have the all right, so we still have the motion, so we'll vote on the motion. Okay, so the motion is on line 1.6, after organizations, insert the words in Minnesota. On line 1.7, after communities, insert the words in Minnesota. And on line 1.8, after the word individuals, insert in Minnesota. Have I got that right, Ms. Clark-Fisk? Okay. So we're all about in Minnesota in this amendment 3 times. Okay, we want to make darn sure that it's in Minnesota. All right, all those in favor of the oral amendment, please say aye. Aye. All those opposed, no. Okay, the motion prevails, and that amendment is adopted. And with that, thank you very much. If seeing no further discussion, the bill is laid over for possible inclusion in the division bill. Thank you very much, Representative Cantrell and testifiers.
Thank you, Madam Chair.